I'll just talk about it.
Okay, well, thanks everyone for joining us in person, and for those folks that have joined on Zoom. I know this is a really busy time of the semester for a lot of us, so I appreciate you making space today. But I think you'll all agree that we have a really exciting speaker here today joining us to share her expertise. It's my absolute pleasure to introduce Dr. Erika Crable, who is assistant professor whose expertise is in health policy, health services research, and implementation science. Her research oftentimes explores the role of policy and politics in achieving health equity outcomes. And Dr. Crable tests dissemination and implementation strategies aimed at improving how research is communicated to policy actors and increasing access to evidence-based substance use treatment for safety net and criminal legal involved populations. She is currently PI of a NIDA-funded K01 testing dissemination strategies to improve access to medications for opioid use disorder and Medicaid benefit arrays. Dr. Crable is also, if that's not enough that she's already doing, she is co-director of their Health Services Research and Health Policy Research Program in the UC San Diego School of Public Health. And she is alumna of the NIMH and NIDA-funded Implementation Research Institute Fellowship and the NIDA-funded Lifespan Brown University Criminal Justice Research Training Program Fellowship, which actually she just shared with me that our former PhD student, Caitlin Piper, was in the program with Erika when they were spent time in their fellowship together. So she has an Emory connection already. She's previously worked also, and I think this is really interesting, that she has worked in a lot of, as a consultant in space that informed a lot of the way that she approaches her work, because she worked as a consultant to the Centers for Medicaid or for Medicare and Medicaid Services, as well as for SAMHSA, and Assistant Secretary of Health and Human Services for Planning and Evaluation, among other state and federal partners. So she's been in the policy, adjacent to policy makers and arena. And so that really has informed and probably strengthened and gave motivation for a lot of the work. So thank you so much, Erika, for flying across the country from San Diego to join us on a beautiful day here in Atlanta to share about closing the research to policy gap with D&I science. Thank you.
Thank you so much. Try and be mindful that the Zoom camera is here and not hide too much from you all as well. But it's a real honor to be here at Emory University. Thank you so much for having me. What a beautiful campus. I feel very tickled to get to be here. So we're going to talk about closing the research to policy gap with dissemination and implementation science. And Emory, of course, is a powerhouse in D&I science. And I know there's a lot of people thinking about policy here as well. So I'm hoping that we can have kind of a conversation. Feel free to, if you have questions during the presentation, you don't have to hold them till the end. We can, maybe Olivia can help me see if there are Zoom questions mid-presentation. But I'm excited to share what I know, learn from you all as well, and think about ways to advance the field a little bit more. So typical acknowledgements slide, very grateful to be funded by the National Institute for Drug Abuse. And also just to note, especially for folks online, these slides are not 508 compliant. So please do reach out if you need an alternative version of this information. So here's our agenda for the chat. We're going to talk about the research to policy gap and why I think it's a D&I researcher's problem to solve specifically. We're going to talk about what do we mean by policy-focused dissemination and implementation. If you are interested, how do we go about framing those types of questions, engaging policy actors in those initiatives, and some methodological considerations to keep in mind as well. And we can have Q&A at the end, but also throughout. Okay. So research to policy gap, right? We often talk about the research to practice gap being 17 years, and we mean that in terms of how people are using research about what we know works and what we know is effective in actual clinical care delivery. I'm going to ask you to take this up to a more macro level and think about the research to policy gap. So this is sort of our failure to translate findings about things that we know are effective or evidence about interventions we know would be useful and put that into evidence-informed policies. So we think about the research to policy gap. Again, we think about prevalence of low-value healthcare services. So I'm thinking about inappropriate prescribing or unnecessary imaging or diagnostic testing services that really aren't needed in the absence of other types of clinical care. And these really, in the US, they represent 30% of all of the care that we provide is unnecessary services. We spend the most on healthcare of any OECD country, and we have some of the lowest returns compared to our neighboring countries, right, that are high income countries. But what does this look like, and why are we really concerned about the research to policy gap in terms of actually causing harms, not just waste in resources, but actual population or individual level harms? I do a lot of work focused on substance use services. And so one great example is contingency management, right? Contingency management are effective programs associated with reduced substance use and prolonged abstinence from drug use. And in the absence of an FDA-approved medication for stimulant use disorder, we really need to be leveraging what we know works, contingency management. But we have multiple federal policy barriers, right? So we have the Stark Law, we have physician self-referral, beneficiary inducement, anti-kickback statute. And so these are barriers where our policies haven't caught up to the current research that we have. We need to be thinking about ways to get current research to modernize policies so that we can remove some of these harmful, outdated barriers to care. Because if we think about contingency management specifically, we're starting to see, you know, we talk about an opioid crisis and opioid epidemic, but what we're really starting to see is the prevalence of stimulants in overdose deaths increasing significantly. Something else to consider is that we're really not doing a great job communicating our results in rigor and relatable ways, right? So there's a growing disconnect between science and policy, but also society's confidence and trust in science. And so we're starting to see a proliferation of misinformation, so I mean false or inaccurate, misleading information, but also disinformation. So when misinformation can be used for malicious purposes, right? And we're in an election year, so we start to see that kind of ramp up a bit. So scientists aren't great about communicating our processes, our findings, but we're also really not great about communicating uncertainties or limitations of our research designs or what we really can measure, what's in our denominator. How are we explaining what the metric we want to share we think is so important? What does it actually mean in non-scientific jargon terms, right? And this is some findings from the Pew Research Center's recent National Survey of Trust in Scientists. We see that trust remains high, but it is decreasing, as well as confidence is decreasing. And those are really important to keep in mind because we don't want to wait until we're in dire straits with the public's view of us, right? Investment in science is still strong, but for how long? So we should think about addressing this in a few different ways. You know, how did we get here is a way I like to think about how to think about the next solution that we need. I think we got to the research to policy gap from a lot of reasons, but some of those are our own faults as researchers, right? Pretty weak dissemination plans where we save maybe a paragraph of text in our grant applications and talk about how we're going to disseminate in peer-reviewed journals behind paywalls. Or present at conferences that cost over $1,000 to attend and are presented for researchers by researchers, right? So we're not communicating to the audiences who are going to use our information. And when we report our outcomes, they're in like prevalence rates. Sometimes that's understandable to a policy actor, but sometimes we report really funky stuff like odds ratios. Like, how do you even explain that in terms that the average person's going to care about? Right, so we're using language that's not always super helpful. And we're not partnering or even talking to policy-making institutions when we think about proposing our research that we want to pursue. Or we talk to them after it's in play when we need their help or when we want to share the findings of it, but not in the development phase. And so, right, policies are timely things. So we need to think about ways to make our research questions a little bit more relevant to the issues that they're actually making decisions on today and tomorrow. And when we think about all of these, as if these challenges aren't enough, we also have to think about how to make sure our policy relevant outcomes aren't overshadowed by special interest groups like lobbyists, right? They're trained and have a lot of resources to communicate or disseminate information, whether or not it's evidence informed. We don't have that training as much as researchers. So we need to think about better ways to get our information out there. So if we do conceptualize this, if we, I often hear people say, oh, if a policymaker would just use the science, they would just listen to the evidence. If we blame them exclusively, it takes it out of our hands to have part of the solution. So if we own part of these problems, these barriers to effective research to policy translation, then we can also start to think about strategies to address it and be the solution. Because I am wondering, right, if we talk about the research to practice gap being 17 years, how long is the research to policy gap? And just as a special plug, in case folks are in this room thinking about this question too, the Implementation Science Journal is the flagship journal for our field. They have a special issue coming out on speed of implementation and speed of evidence. So I'm hoping someone does something around policy speed. That would be really cool. I'm not sure if anyone's working on it. Okay, so if we accept that the research to policy gap is a D&I scientist problem to solve, what do we do about it? I put the spoiler here because maybe you're online and you need to leave early, or maybe you have to leave the room early, or you just want to know the answer up front. I think the spoiler is we can do more policy-focused D&I questions and think about intervening in the policy making process with more evidence and thinking about intervening to support evidence-informed policies when we see them come through the design process and really supporting them be translated from paper to actual brick and mortar services people can access. I think we need new collaborations across interdisciplinary fields. D&I is inherently interdisciplinary, but sometimes we rest on our laurels of saying that, but we still don't actively reach out to other fields like political science or public administration, social work, et cetera, fields that have been dealing with policy relevant decisions for some time. But it's also about collaborating with policy actors, collaborating with them as participants in your work or partners in your work. I also think we have an opportunity for new measures and outcomes. I had a really fun opportunity to talk to some of the students in this room earlier today about measurement and outcome issues. So I think that there's a lot of opportunity for you all to continue to grow the field and advance it with your new ideas. We need that. So let's do some level setting. And in case you're wondering what this picture is, this is the National Library of Congress in DC. It's really beautiful, and it's really hard to think of pictures that are relevant to policy or science, So here's a pretty picture of a cool room. Please go to the Library of Congress when you're in DC. It's free. Okay, so let's do some level setting on what do we mean by policy D&I. Well, we have a great definition of dissemination science from the NIH. It's the scientific study of the targeted distribution of information and intervention materials to a specific public health or clinical practice audience. And again, I'm just asking us to take that up to a more macro level. So if we think about it at a macro level, policy-focused dissemination science could be investigating the most effective processes for communicating evidence to policymakers so that it's used in decisions that impact public health. And when I say policymakers, I'm using that as a huge term, right? What do I mean by a policymaker? I mean a street level bureaucrat, someone who makes decisions on a daily basis, but maybe isn't an elected official, right? Be like a sheriff's department. I also mean staffers of elected officials who are really doing the legwork of policy design and policy implementation. I also mean the elected officials, right? Could be anybody at your local to state to federal agencies. This is also the Library of Congress. And if we think about that in terms of implementation science, we take our traditional definition that it's a scientific study of the use of strategies to adopt and integrate evidence-based health interventions to improve individual health outcomes and population health. But if we shift it to the macro level, policy implementation science can help us investigate effective strategies and processes by which evidence-informed policies are put into routine practice. And please note that I said evidence-informed policies, because there is no such thing as an evidence-based policy. Policies are based on a million things: resources, time constraints, lots of different information sources. And if we do our jobs in dissemination science, evidence can be one of the things that informs it, but it definitely won't be the be all end all. And that's just a healthy expectation to have in mind. Okay, so now if you're interested and we're thinking about policy-focused D&I research, what could our questions look like? I'm sure, it sounds like Jonathan Pirtle was here at one point, which is awesome. So you probably have seen this paper that he recently wrote with some colleagues, a few simple ways to think about policy D&I. He kind of leverages the Jeff Curran model of making implementation science too easy, as he puts it. So Dr. Pirtle talks about policy as something to adopt, making it the thing, as Dr. Curran would say, something to implement, a context to understand, or a strategy to use. And this is great. It's very chewable. You can think about how this looks in your work, but Emory is a powerhouse for D&I. So I'm not going to let you all sleep on this easy definition. We're going to take it to like the next level class about ways to think about policy D&I. So I kind of like these ideas. So the first way is to think about it as a formative study of policymakers, right? So this is typically contextual assessment of the mechanisms, determinants, which is a fancy word for barriers and facilitators, that influence the use of evidence in policy. So you could identify factors that mediate or moderate policymakers' use of evidence, or the adoption of an evidence-informed policy. Dr. Pirtle's done some cool work looking at determinants of the use of research when developing child mental health policies. He did that in a national survey. These formative studies of policymakers' awareness, attitudes, and preferences are typically surveys or interviews, or maybe even document review if you're just kind of looking at what they've said on the record publicly. But importantly to note, I mentioned up front that I think we need to be working more interdisciplinary. There are lots more examples of formative studies of policymakers and how they use evidence from the fields of public administration and political science and traditional policy research, or health policy implementation research, not the D&I field of it, but the more traditional field of it under health services research. So there's lots of examples to learn. We are not reinventing the wheel here. The idea is to go learn and look at what others have done and think about what hasn't been measured or what could be thought about in a different way, given the dynamic nature of policy contexts and how they change so frequently. It brings us to dissemination effectiveness studies of policymakers. This is my jam. This is what I really like, and this is what I have a current study on. So here we're thinking about testing dissemination strategies for their ability to actually change how policy is made, or change how policymakers use evidence, their awareness of an issue. And you could use any kind of study design for this. I think mixed methods is kind of most useful here. And you can bring in some policy surveillance or legal mapping approaches, right? So you can see what elements of the law have the most movement in terms of changes in their evidence basis. And we have a study right now where we're actually doing a national study of all of the state and territory Medicaid programs and all of their contracted managed care organizations to look at what are the ways in which the people who make decisions about what substance use treatment services are covered, how do they use evidence in their decision-making process? What information are they using? Is it scientific evidence? Is it current evidence? Is it anecdotes? Is it stigma-driven? Is it outdated? We're seeing a lot of heterogeneity in our findings. And I didn't put the data up here specifically from that project because we're still collecting a lot of data on this effort, but happy to answer more questions about it. But the goal here is to look at all of that heterogeneity in the way folks are engaging with different information sources, who their trusted intermediaries are for information or for science or for maybe for misinformation that they think is correct information. To look at that heterogeneity use of latent class methods to identify subgroups of policymakers that act more similarly than others. And then you end up with less heterogeneity to work in, right? You end up with subgroups that represent the mass of the nation's, Medicaid programs. And then you design dissemination strategies tailored to each subgroup identified in the latent classes. So you're designing dissemination strategies to their evidence-based behaviors, or maybe their concerns about evidence for medications for opioid use disorder, which is what this project is focused on. And then we're sort of matching and mismatching strategies to see if tailored dissemination strategies are more effective in changing policies about what medications are actually covered so that people can have access to really frontline treatment for substance use disorder. We also do policy implementation studies, policy process implementation studies, right? So this is when you think about what's the actual process to implement a policy. What are the barriers and facilitators to implementing that policy, or the perceptions of implementation strategies used to get the job done? This is really interesting. Again, lots of examples from 30+ years of policy research on this. The idea here is, what do we learn so that we can intervene with from a D&I perspective? That's what sort of public administration and political science haven't done. They don't necessarily think about intervening on the process. And here we're looking for windows of opportunity to intervene. There's another example of a study I did where I wanted to understand how, well, a couple things. There was an interesting policy window where the Centers for Medicare and Medicaid Services asked states to look at their Medicaid benefit arrays and say, how do you create a continuum of harm reduction, treatment, and recovery services for folks living with substance use disorders? How do you build out a full continuum of services that meet people where they're at, rather than telling them to get with the program? It was really hard because a lot of states were coming to it with massive gaps, total dearth of services in some states, because there's not a lot that they were required to do around substance use treatment. So they were really, states who wanted to take this on were taking on a big lift in many cases. And so when I saw this, I thought, why would a state agree to do that? That's a huge lift. Why would they agree to this particular window of time in this particular way with a lot of CMS scrutiny on what they're doing? And then once they write the perfect care continuum of services out, how do they actually translate that into brick and mortar services? And so I started dissecting the process with qualitative interviews and document review. And what we saw was we created a taxonomy sort of mapped onto the ERIC strategies, if you've seen those, but a taxonomy of looking at what were the actual naturalistic implementation strategies that each state agency was leveraging to get the job done, to bring people to the table, to agree on what services would be covered, to get money to fund those new services, to train up providers on how to get reimbursed for those new services in Medicaid that had never been covered before, right? To get people to not be afraid to try. So you could look at a policy implementation process study totally observationally like that. But the idea here would be to then use that information to intervene in some way. And that brings us to a policy impact implementation study, right? So you actually look at what's the utility of those chosen implementation strategies for facilitating uptake of some evidence-informed policy or de-implementation of a harmful policy. There are plenty of policies on the books that should probably be de-implemented because they're not based in evidence. So again, any study design would do, but we do see a lot more of these as observational. And if you're in the consulting space like I used to be, this often starts to look like technical assistance, right? How do you get the evidence-informed policy actually put into place? How do you support that process? I work with Dr. Gracelyn Cruden at Chestnut Health Systems on a data-driven decision-making study funded by NIDA in Oregon, where we're actually doing this in a stepped wedge randomized controlled trial, where we are using group model building sessions to bring that's our policy implementation strategy, well, a component of it at least. But we're using those sessions to create a shared vision about what data and what evidence are useful to answer the questions they have about resource allocation for substance use treatment, and other recovery support services. And so we're actually looking at what's the effectiveness of that group model building, policy implementation strategy, and data products that will develop from it in terms of actually changing the way that they use evidence to allocate resources or to support providers delivering these services across the state. And we're doing that through a real combination of surveying folks involved in it, interviewing people from the state, from the governor's office, from various state agencies and boards, all the way down to the behavioral health resource networks that are set up across the state to deliver these services. But we're also importantly combing through documents and looking at not only are we seeing evidence-informed policies developed based on the data products we created? Do we start to see the data we presented to them in those group model building sessions get used in the policies or even referenced in public testimony or in decision-making processes? And you can look at that. I mean, it's kind of a long game. We talked earlier today about incrementalism. Most policy change is about policy termination rather than policy creation. So you can start to look for indicators of this in terms of proposed policy or public testimony or conversations about a potential policy being implemented if you don't have the window to look for a policy actually being passed. So we talked about a couple different types of way to frame your research on this, but I think that we need more policy use inspired research questions. So I'm thinking not just research for the sake of that's interesting to study, but research that has a value for a policy context that are problematic for public health and need more evidence into them. We need to be thinking about how to actively, timely intervene in the policy design and policy implementation process with evidence, not just observing at the policy level and saying, well, what was the impact of that study? Or what was the impact of that policy, whether it was good or bad, whether it was evidence informed or not. And I think a good way to do that is to think about ways to creatively engage with policymakers and policy-making institutions. They come in all shapes and sizes at all levels of governance. You could even think about this in terms of little p policies, like organizational policies in your local hospital or health system, right? But we just need to be thinking more about how to design these questions in a use-oriented way. So Grayson Cruden, myself, and some other colleagues developed this paper. Who's in the room where it happens? Has anyone seen Hamilton here? Okay, maybe people online also have seen Hamilton. I'm not a huge musical fan, but my colleagues are. So I feel like that's an important disclaimer. So there's a song in Hamilton, right? I want to be in the room where it happens. And the room where it happens is where policy is made, where decisions are being set. So how do you figure out if you're trying to intervene in the policy making, implementing, planning process, you got to get in the room, right? The proverbial room. Sometimes it's actually a physical room. And so I'm not going to go over all the steps and how we all wrote this paper, sort of putting our heads together, trying to say, well, how do I approach it? And then we kind of standardize our approaches into some steps that other people could use. But importantly, we also thought about who are the people we look for as indicators or as inviters to that special room where decisions are being made. So we identified some folks that these are the 5 people I often look for anytime I'm thinking about a new research project at the policy D&I kind of focus level. So look for developers of the policy. So you're usually your highest level decision makers who are crafting or revising or even passing the policy. And notice that it's the highest level decision makers, not the highest level policy actors, right? I often talk to staffers instead of the elected officials because they're doing the meat and potatoes of the policy development process. But they often are go without getting credited or having real visibility. They look for disseminators, people who are responsible for communicating between policy developers and policy implementers about the policy, what actually was created, what is its primary form and function. We'll talk more about form and function in a minute. So this is a lot of different government staff. Sometimes it's hopefully academics are in the mix in that, right? But sometimes it's advocates, sometimes it's different media sources. This one you have to be a little more creative about how to find. And again, we had steps in the paper for how we all approach that. Then we look for implementers, the people who are actually responsible for the pre and active implementation and maybe some policy sustainment, right? These tend to be people tasked, in the Medicaid context, I often look at people who are, managers tasked with special ownership of that particular demonstration or that particular initiative. But it could be a lot of different people, middle managers, frontline workers, special interest groups. And then we start looking for influencers, people who communicate information to influence which evidence is trusted and used in policy. Influencers are not always the same as developers, right? We might want to be the influencers. We have research that should be used in policy-making processes. But oftentimes influencers include lobbyists. They can include media, right? Political discourse or media discourse around a topic can sway how people think about it. Even the decision makers who are developing policy. But I think an understudied area, at least from a D&I lens, is thinking about public comment and voters, constituents as influencers. In a lot of government work, those public comment periods that open are really wildly important and people actually read them. So as academics who have specialized expert knowledge, don't sleep on the public comment opportunities. And then finally, we look for enforcers. Because depending on what part of the policy D&I process we want to intervene on, we might need to be thinking about monitoring policy compliance, right? If you have a policy that has no teeth, maybe it's an unfunded mandate, it doesn't matter, right? You're not going to have successful adoption of something or sustainment of something. So think about whether that enforcer even exists and what their role really is. And just another note here, we look for these people to better understand the policy context and the policy's influence over our D&I effort. If policy is the thing, then we need these people to be thinking about how do I effectively design, dissemination strategies to influence the developers or the disseminators. How do I actively design implementation strategies with these people in mind as action targets or partners in my initiative? They serve a role in your research beyond just sort of wanting to know who they are from a contextual perspective only. So some colleagues and I have been thinking about what would it mean to partner with policymakers or policy actors, and I'm using that term policymaker, policy actor in a really broad way, thinking about it as an individual, a group, an institution who is directly or maybe indirectly, formally or maybe informally, shaping the policy and implementing process at any stage. Going back to those list of 5 people, thinking about their role at any time. We started designing this sort of continuum that helps us contextualize where we sit and the kind of work we want to do. I think a lot of D&I work to date has had very little consideration of policy level factors and actors. So that would kind of be in this orangey box, right? And we see indications of that because we see folks talk about policy implications in the last section of their manuscript and the conclusions. Oh, funders should use this information, even though I'm putting it in a journal funders aren't going to read, right? Or this one drives me nuts. When I see people write, we love our theories, models, and frameworks in D&I. And we all have internal, external setting, inner context, outer context, it's all the same, right? But when we say the outer context or the external setting and we say the broad outer context, the socio-political outer context, I still don't know what that means. And it is a personal gripe of mine. So we need to be a little bit more specific about what we mean here. If we are, we can think about living in any of these next 3 boxes. So really thinking about context of D&I efforts in policy making spaces, right? So identifying what role policy is playing, but identifying ways to leverage the policy context for D&I success. So if policy is not your thing that you're trying to implement, but you see a policy that could act as a facilitator for your thing or precondition for your thing being more successful in adoption, think about that. How might you frame your work in that way then? You can also actively engage policy actors and their networks in research. So when I say networks, I think about issue networks, right? Who are all of the people who touch a policy, not only those 5 types of people I mentioned before, but they're trusted intermediaries, they're advocacy groups that come to them with information, things like that. How do you actively engage them in the research design process or as participants, right? I really like to actually come to them when I have a research idea up front and say, does this pass your like litmus test for maybe value? Is this a good question to be asking? Does this feel relevant to the issues that you're facing? And then they've given me really helpful feedback in terms of reframing an aim or even piloting an instrument. That's been great. And also redefining outcomes, because I do think, and I'll talk in a minute more about it, I think some of the outcomes we measure in D&I science are wonderful, but maybe not always appropriate for a policy level work. And then if you get really, really brazen, you can co-produce research with policy actors and have them as real partners in your research design, data collection, analysis, and interpretation process, and of course, your dissemination efforts. This is really hard work and requires special windows of opportunity, right? And creating partnerships early and checking in on them often. So just something to keep in mind as you think about what kind of questions you would be asking. I am going to wrap it up in just a sec, but I wanted to go over a couple of opportunities because I met with a bunch of students today who are interested in the policy D&I space and thinking about what questions they want to ask. So I'm going to actually ask you all for something. I'm going to ask you to leverage these methods opportunities that at least I see. I'm sure there are others. And help us make the field better. Help us do more value-focused work at the policy level. So the first thing is, on a high level, I am going to mention that I think we use theories, models, and frameworks to guide as roadmaps for our studies. I'm really a big fan of theories, models, and frameworks. I really am. But I don't think that they're well optimized for policy level factors for the reasons we previously talked about, that broad socio-political context language, or not even considering the different types of actors that we might need to engage with. So rather than creating, I think, the 165th theory, model, or framework for D&I, I'd like us to think about what works from other fields. Call up your friends in other disciplines who have been doing that traditional policy research for a long time and learn from their works, right? There's so many models out there, or at least theories and pieces that you can take to actually optimize a D&I framework where the goal is to intervene, right? So again, we're not replicating the work that public administration or political science has done, because that's typically been observing, not intervening. What we're saying is take all the information we got from observing and not intervening, and then figure out how to intervene, right? I think everyone often likes to talk about Kingdon's 3 streams. You have the problem stream, the politics stream, and the solution stream, the policy stream. And when they come together, a magical window opens and you can pass a new policy, right? I like to think of D&I science as the crowbar. I'm not waiting for those streams to come together. Like, I want to open that window. I'm going to use a dissemination strategy, or I'm going to use an implementation strategy to do it, so we have more evidence-informed policies. I also think we have some measurement needs. We need more mixed methods. As a qualitative researcher, I do love getting into those thick descriptions, but I think we need more quantitative scales as well. There's a great paper by Peg Allen and colleagues about quantitative measures of health policy implementation, determinants, and outcomes. It's a systematic review and is summarizing the policy level quant measures we have to date and showing a real lacking in the methods there. And again, I mentioned it before, but we're measuring a lot of acceptability, feasibility, appropriateness, compliance. I'm not sure those are the right outcomes for policy actors. I often wonder about their capacity to use evidence. I don't mean that in a bad way, but if we're producing evidence in essentially foreign language to them, what is their capacity to use it, right? Are there other outcomes of interest we could be measuring? Right, so thinking about those relevant outcomes that we could create, I think you need to first ask yourself what role policy is playing, right? If policy is the thing, Are you looking at acceptability of the policy as a vehicle or acceptability of the evidence in the policy or lack thereof? When you talk about adoption, what are you measuring? Passage of the policy or actual use of the policy or compliance of the policy? We need to get specific with our language. And when we think about reach of a policy implementation or reach of a policy dissemination effort, how are we thinking about health equity in the context of reach, right? Who's not being reached? So there's lots of ways to think about it. You know, I also think it's worth mentioning that sustainment is a goal that funders often want to see and sort of the thing that we want to get to with evidence-based practices, right? We want sustainment, institutionalization of something so that you don't even have to have an implementation effort for it. It's just the new normal. What's that mean for policy? Should policies, even if they're evidence informed, be sustained? I'm not sure they should because context changes, society changes, evidence changes. So some policies should be time limited or should be updated. So what's sustainment mean for policy D&I efforts? I'm not sure. Maybe it's sustainment of evidence channels into the policymaking process. And if policy itself is a determinant and policies are always changing or being more or less followed, more or less enforced, depending on the resources allocated to it and the roles of enforcers as they're defined, you know, how does policy as a barrier facilitator shape your implementation effort over time? Is it creating a context in which your implementation effort is more or less successful? A couple of methods considerations before we wrap up. Policy change is slow. We talked about incrementalism and most policy being about policy termination rather than policy creation. So be mindful about what you actually want to measure and can say or set expectations for in a study, right? You need to manage expectations of not only your funders who might want to see sustainment or policy change, which are really big asks in a 5-year period. But also be mindful of the outcomes that your policy partners might be expecting or wanting. I never say that I'm going to promise that they want to sustain something we implement, but I say we're going to set you up to sustain it if that's the choice you make at the end, right? You're thinking about it from the start still, you're building infrastructure from the start, but I'm not going to promise that we'll actually sustain it because you may not want to when we get to the end of it. It's hard to randomize policy making and implementing processes. You know, constituents don't really like you changing their lives for the sake of a study. Policymakers get nervous about that too. But there are other ways we can do this, right? We can think about feasible things to randomize on. You could think about randomizing the strategy itself, or think about randomizing the types of policy actors that are getting the information from you. There are lots of ways to do this. We're doing a stepped wedge design in that Oregon-based study I mentioned with the group model building. And then use other theories, as I said, and skills and methods from other disciplines to guide your work. All right, this is the last thing, and then I promise we're gonna go to Q&A. I've picked on theories, models, and frameworks quite a bit, so I figured in giving you, giving some critique, I'd also give a solution. So some colleagues and I worked on this project a little while ago. We took our anecdotal thinking that most D&I theories, models, and frameworks talk about a broad sociopolitical context or non-policy relevant factors, and we decided to test it. So we did a scoping review and found that a lot of the policy D&I frameworks, or all of the D&I frameworks that are out there, only 26 really mention policy, which is kind of sad. And a lot of them are content or setting or population specific. An odd amount are in the nursing space, and that might not translate to your space. So we need more flexible frameworks that mention policy, right? So we started looking at what was done, and then we started looking back at the fields that we were all trained in, more policy focused fields, and said, are there recommendations we can take from these other fields? And so we came up with this idea of specifying the form and the function, right? So when I talk about policies function, I'm talking about the policy's primary goals. What type of policy is it? Where is it coming from? Is it a federal policy? Is it a state policy, an organizational policy? What's the context that's going to get affected by it? And is that context multi-level? and what capital importantly is being exchanged by it, like money to fund something or time to do something. Think about its form, right? Where does the policy originate? Who are the policy developers and what did they want from this process? What's the policy structure as a result? Is it a mandate? Is it an unfunded mandate? How permanent is it? Is it time limited? Is it a demonstration? And what are the intended and unintended outcomes of that policy as it was written? And then, you know, a lot like implementation, policy making and implementing is nonlinear. So think about those nonlinear phases of policy design and policy implementation. Are there some useful temporal benchmarks that you can use to inform your D&I processes or when you deploy a strategy or when you measure an outcome of interest? How do the contexts change over time? Do new competing or supporting factors arise? And consider the policy relevant actors at play and what their roles are in each of those nonlinear phases. I mentioned those 5 types of actors. Are there other ones, or what are the roles of those 5 over time? And do they shift in boundary spanning ways? My work with federal and state agencies, the smaller the agency, the more boundary spanning I see. So that's actually kind of nice for me, because then it's one person I can keep contacting over different phases of time of the policy being designed or implemented. And think about the context adaptations that you need to put into your frameworks, right? Are there, what's missing? I don't see partisanship. I don't see political will. I don't see media attention. I don't see societal norms or values. I don't see workforce capacity in these theories, models, and frameworks. All things that are huge, huge issues for policy relevant work. So be mindful about adapting your inner and outer context, your external or internal setting, however you want to call it, whatever your framework of choice. Just think about what adaptations you need to make and justify it, right? And then look for bridging factors needed for policy transfer. So if you've used the EPIS or exploration, preparation, implementation, sustainment framework, you know that EPIS has this funky thing in the center where they've got outer context, inner context, and then this idea of alignment promoting factors between those 2 contexts called bridging factors. Bridging factors is an EPIS term, but this idea of alignment, cross-context alignment promotion is not an EPIS construct, right? That's true of all D&I theories, models, and frameworks. So using the EPIS language, think about what those bridging factors might need to be. Are they data sharing processes? Are they trusted intermediaries? Are they relationships? Are, you know, they certain structures like memorandums of understanding or something like that that needs to get set up to promote policy transfer from where the policy was created to where it needs to be implemented or adopted? So I'll leave it at that because I think I threw a lot at you. But in summary, I think that we have a huge research to policy gap. And it's getting kind of scarier with the proliferation of misinformation and disinformation and the proliferation of policies that affect social determinants of health, right? The Supreme Court is hearing a very scary case today about whether it's okay to penalize people who are unhoused and sleep outside. I think we need to be thinking a lot about policy in our work and how to just support evidence into that process. The decision to intervene and share evidence is no different than sharing evidence in a clinical setting where you want to change how healthcare is delivered. You're just moving it up a macro level. Doesn't make you an advocate because you're still just putting in research there that is objective and unbiased. So thanks so much for your time, and I'm happy to take any questions you have. Is there a question online?
Yes, there's one in the chat.
Okay. Okay, so this person says, tell us about, or Natalie, you should also feel free to unmute if you'd like.
I'm happy to. Thank you, Dr. Crable. That was amazing. I'm a fan of yours. I've been reading a lot of your papers recently and really agree with a lot of what you've said in terms of where we should be pushing our research. As I'm thinking about this in my own work, and I know you've said that there are a number of people who could qualify as a policymaker. I have also just struggled with this a little bit in terms of thinking of this systematically in terms of identifying the actual sampling frame for those folks. And so I just wanted to get your perspective on that. So if they are staff, like how do you know who all of the staff are that might actually be writing laws, or how have you gotten to that information? And then what's your experience been reaching them?
Oh my gosh, you asked a really, really hard question, but it's a really important one too. And thank you so much for your kind words. Okay. Yeah, this was the challenge. I'm looking over here because that's where the camera is online. I don't want to keep alienating you all too. This was really hard on a current project I have where we're surveying all of the state and territory Medicaid agencies as well as the managed care organizations who administer Medicaid benefits. I wanted my sampling frame to reflect the people who are making decisions about what substance use services are covered in the benefit array and what utilization management strategies are applied and when. So I can look at a state agency that I know and talk to a state agency and say, who are those people in your role? Is it directors of behavioral health, behavioral health managers? Medicaid directors are really high up, but they don't really get involved in the day-to-day, but maybe they're important to include, not sure, right? You can look at people who are utilization management teams, people who write contracts for the managed care organization. There are so many different people. So eventually I came up with this list of, I thought about those 5 categories of policy makers that I mentioned earlier, and I came up with a list. And I translated it for state Medicaid agencies that I'm familiar with. And then I called up some people I know at the state agencies and said, is this the right person to ask? And they were like, why would you ever talk to that person? That person, like, manager is like entry level. They're not in the room for those conversations. Please do not email my staff about that. And I was like, oh, who should I email? And they're like, oh, it needs to be the population health manager. And I was like, huh, okay, sure. It sounds like a similar title, just sounds like a different division. So it can be hard. I talked to other agencies where managers are really high up title. I think it's really tricky, and it's something that I'm working through in my own work, depending on the scope of the project, right? Like, this is particularly hard because the joke about Medicaid is if you know one Medicaid agency, you know one Medicaid agency, right? They're not uniform in any way, shape, or form. So it's just a lot of conversations, a lot of talking to people in the Medicaid space early and often about how I'm framing my data collection, my instruments, and my sampling frames. But if you're thinking like county level or, specific agencies, I think it gets a little easier. It just depends on the scope of what you're doing, and it's a lot of trial and error. I wish I had a better answer, but I'm open to how others think about it.
Thank you.
Yeah.
Hi, so I had a question. I know that you had mentioned earlier how researchers don't always get the same amount of training of public health communication as lobbyists, for example. So as a professional right now, what would you say would be the best ways to train, upcoming researchers and public health students to be able to communicate public health findings at a similar level of effectiveness with people like lobbyists? Yeah.
Okay. So, and I'm going to repeat it for the folks online in case they didn't hear, and so you can correct me if I missed part of it. So the question is, as a public health student, or earlier in your career even, how do you think about getting the training to effectively communicate research and the science that we're doing with different audiences that aren't researchers? Is that it?
Yeah,
Did I miss any part?
particularly pointing to like the thing you mentioned about like lobbyists, for example, and how they seem to have the training that we don't have. In that
Don't
regard.
they?
Yeah.
Yeah, they do. Yeah, okay, and particularly in the context of not wanting to be overshadowed by lobbyists who are really well adept at doing this kind of work. Well, I think there's a lot of creative ways to think about it. One is to look at organizations who are doing this and have really cool models and skills out there. So one of my favorite places to look at trainings from is the McMaster Health Forum in Canada. They are a WHO-funded site for the rapid translation of evidence into policy, and they do some trainings. I think I'm not sure how many are free, but they have a lot of resources on their website. It's run by Dr. John Lavis. He does really cool work. and really tries to put practical things out there for researchers to use. So I would look at stuff like that that's rapidly available. You all had a great framing science presentation that is on YouTube. And so I would also look at that because that was super cool with Lynn Davey. I was really into that. Academy Health is on, sorry, but they're doing a really expensive training on communicating for impact. I'm registered for it, and I'll let you all know how useful I think it is. So there are stuff like that, but certainly if you're early career or you're a student, these paywalls get in the way. So one of the things that I like to do is, you know, we're at universities for a reason. There's a lot of different people, a lot of different expertise around. And it can be scary to do like a cold knock on someone's door, cold email, but there are many other places we could get our training or do our work that would pay better and be less difficult environments to work in than universities. So why we're here is because we have such easy access to things. So go over to the School of Communication if you all have one, or journalism program, or School of Education, whatever you have, and just ask people to meet, ask to audit a class. I think, you know, even if you're not at a university anymore, if anyone were to cold email me and ask me to just talk about my work, of course, I'm gonna say yes. We all love talking about ourselves and our work, right? So like, assume that someone's gonna be excited to do it and share their knowledge with you about some approaches they have.
Thank you so much.
Yeah, I will say, you know, I think there's a lot of interest to say that D&I, especially dissemination science, should look at marketing and lessons from marketing to frame dissemination strategies. I'm not sold. I think of that because I don't think that marketing is the appropriate skill set for some of the more delicate public health topics. Like I do substance use research, right? Or I do research around criminal legal initiatives or settings. I don't know that marketing is going to give me the skills that I want to talk about those topics, but there are other fields of communication that could do that too. So don't just do the one thing that everyone says. Really think creatively and out of the box and bring those people in as collaborators.
Any other questions?
My question in there. So you've kind of been talking to us as D&I people, which is right. Yeah. And you know, how we can do policy better, how can we draw on policy sciences. And so if you were going to switch that, and I know you already mentioned, let's not just observe, let's intervene. So that's one thing that the policy sciences could do. What else could they borrow from the D&I?
Say it again.
What else could policy borrow from D&I as opposed to, or take, or do better, or apply, as opposed to, you know, how use.
Yeah, so the question, and I'm gonna, again, let me know if I got it wrong. So the question is, we talked about what D&I scientists can learn from more traditional health policy fields. What could they learn from us? So I think definitely, that's so funny. I gave a presentation as part of the implementation. There's an implementation science masterclass in at King's College London that I did with the political scientist Paul Carney. And we did it together at a workshop focused on what is policy D&I, because we have wildly different views of it, right? And it was great because we disagreed the whole time. So that was lovely and really useful, right? Because he's sort of, I don't want to put words in his mouth, but my takeaway, at least, maybe I misinterpreted, but my takeaway was there's a lot going on. You have to observe it in its holistic nature and deal with the complexity of it, which can be a lot, but sometimes intervening is not feasible or appropriate. And I thought, no, public health mentality, like I've got to intervene in some way that's useful, right? So I do think that figuring out ways to complement how we learn from their really rich contextual understanding and process knowledge about policy creation and implementation is important, and really communicating, like having them think about, well, how do we identify the right window to intervene in, right? And us communicating to them about what intervening could look like. It's not about massive intervention. Could be about smaller scale things, like just sharing evidence with targeted decision makers at the right time. I don't know, it's a good question. A question for the students in the room to pursue maybe.
Well, thank you, everyone. And we, for those who are in the room, we have a reception afterwards, so more informal questions and conversation can be had. Thank you for the folks that joined online, and thank you once again to Dr. Crable for making it happen.
It's a real honor to be here at Emory. I appreciate you, and thank you to everybody who joined online. Appreciate your time.
Should I just hit end? Yep, that sounds great. Thank you.